All right, let's talk about a pain so many of us know. That stubborn ache in the wrist that just makes everything harder. You know, typing, cooking, even just scrolling on your phone. But what if I told you the key to unlocking that pain isn't in your wrist at all? I mean, think about it. You've probably tried the wrist braces, right? You've done the hand stretches, but that nagging pain, that feeling of weakness, it just sticks around. It's a super common story, and it usually means we're looking for clues in the completely wrong place.
Yeah, you heard that right. The real answer, the start of this whole mystery, could actually be hiding deep inside your neck, in your cervical spine. It sounds kind of backwards, I know, but stick with me, because this idea could totally change how you listen to your body.
Okay, so let's really dive into this unexplained ache. Our hands and our wrists, they're how we interact with the world, right? We use them all day, every day, and we never give them a second thought until they start screaming at us.
Does any of this hit home for you? Like, you can't get through a workday of typing anymore? Or maybe you play an instrument and there's this sharp pain that just ruins it. It could even be a weird weakness when you're just lifting a bag of groceries, or that constant dull ache right in your thumb. You know, these aren't just little annoyances that get in the way of your work, your fun, your life. They're signals, and we should probably listen to them.
So to solve this puzzle, we have to become detectives. We've got to follow the wiring, trace the signal from where you feel the ouch all the way back to the source, to your body's internal command center.
And here it is. Meet the star of our show today, the C6 spinal nerve root. I love this description for it. The wrist and thumb command center. It's perfect. This is a crucial nerve that pops out of your spine right between the C5 and C6 vertebrae in your neck. And it's the main communication highway down to your hand. Now this is where it gets super cool. Every spinal nerve, including C6, has two main jobs. Think of it like two sides of the same coin. First, you've got the myotome. That's its motor function, the muscles it tells what to do. For C6, that's the muscles that let you bend your wrist backward. Then you've got the dermatome. That's its sensory job, the patch of skin it gets all its feeling from. For C6, that's your thumb and the side of your hand and forearm. So one nerve is in charge of both movement and feeling.
All right, so we know C6 is the command center. Now let's actually trace that signal path and see exactly how a little snag up in the neck can cause such a big problem all the way down in your hand.
And this shows that chain reaction perfectly. It all starts with something simple like bad posture, you know, that tech neck we all have from looking at our phones, or maybe a disc issue. That creates stress that pinches or just irritates the C6 nerve root right as it's trying to leave the spine. And from there, well, that angry nerve starts sending out faulty signals down its highway. Pain, tingling, weakness, straight to the wrist and thumb.
So how do you know if C6 is your culprit? Well, there are some really specific telltale signs. Notice how they follow that C6 map we just talked about? A pain that travels from your shoulder down your arm, numbness or tingling specifically on the thumb side of your forearm, or weakness when you try to do that wrist-bending back motion. It all points right back to that one nerve. Okay, we've identified the problem, we've traced it back to the source in the neck, so what do we do about it? Well, the goal is to fix the real problem in the neck, not just put a Band-Aid on the symptoms in your wrist.
And you're gonna like this part. This is the good news. You don't always have to jump to some extreme solution. For most cases of what doctors call cervical radiculopathy, that's the official term for this pinched nerve issue, conservative, non-invasive treatments are often incredibly successful.
And check this out. A case study from the Journal of Chiropractic Medicine followed a patient who got this kind of conservative care, including spinal adjustments. The results? Pretty amazing. After 90 days, their symptoms resolved completely and did not return after 1 year. That's a powerful, real-world example of how well this approach can work.
But the path to relief isn't just about physical adjustments. Nutrition plays a huge part too. The whole idea is simple, really. You want to help your body heal itself from the inside out. And you do that by calming down inflammation and giving it the raw materials it needs for nerve health. Now, the research we're looking at included a really specific nutritional plan. It focused on a few key areas. First, using something like inflammatone to help fight the inflammation that's causing the nerve compression. Then adrenotone to help manage the effects of chronic stress. Then Omega Val Ultra,
with its omega-3s to reduce inflammation everywhere and literally feed the nerve coverings. And finally, GI Revive to make sure your gut is healthy enough to actually absorb all these good nutritions. It's a whole-body approach to recovery. All right, now for the stuff you can do every single day. Let's talk about the proactive, daily habits that can protect your C6 command center and hopefully keep these problems from ever showing up in the first place.
And look, these are all simple but incredibly powerful tips. See how it all connects? Keeping your head stacked over your shoulders, that directly takes pressure off those neck vertebrae. Setting up an ergonomic desk, that keeps your wrists happy. And there's nutrition again. Eating foods that calm inflammation instead of cause it. It's all part of the same picture.
So, if you only take one single thing away from all of this today, please let it be this. Our bodies are these amazing, complex, interconnected webs, and this C6 nerve is the perfect example. Where you feel the pain, that's a clue, but it's not always the crime scene. You have to follow the evidence back to the source. And that kind of leaves us with one last big question to think about. Once you understand this principle, you become a much better detective for your own health. It makes you pause and ask, what other signals is my body sending me? And where are they really coming from?